Welcome to The Explainer. Today, we're diving into a really groundbreaking study that puts an AI assistant right in the heart of a cancer clinic. The goal? To see if it can help overworked care teams make better and faster decisions for their patients.
So, to really understand why this is so important, you have to start with this pretty stark reality. Imagine you or someone you love gets a cancer diagnosis. You'd hope a whole team of experts would spend a good amount of time on your case, right? But the truth is, these specialists are in a massive time crunch. 2 minutes? That's barely enough time to go over the basics, let alone really dig into a complex treatment plan. And that is the crisis this new AI is designed to solve.
So, to really get why this is such a critical issue, we need to zoom in on a really key part of the cancer treatment process, something called the MDT meeting.
Now, these MDT meetings, they're basically the gold standard for cancer care. They've been required in the UK's National Health Service since back in 2000. And the whole idea is that they act as a safety net, a place where different experts can all put their heads together to make sure every single patient gets the best possible plan.
But here's the catch. As the number of cancer cases keeps going up, these absolutely essential meetings have just become completely overwhelmed. And what happens then? Well, you get rushed reviews and this intense pressure, which means there's a real risk that the most complex cases, the ones that really need that deep dive, just don't get the time they deserve. And the strain isn't just on the clock. Getting all of those highly paid specialists together in one room is incredibly expensive. We're talking up to £10,000 a month for just one team. It's just another clear sign that the whole system is under a ton of pressure and really needs a smarter way to work.
Okay, so if the old way is buckling, how can technology help? Well, this new study introduces an AI clinical assistant that was designed to tackle this exact problem of time and resources. It's called Prostate DS, and let me be super clear about its purpose. It is not here to replace doctors, not at all. The goal is for it to act like an expert assistant, a kind of triage system that helps the human experts focus their incredibly valuable time where it's needed most.
So, the AI's main job is to find the cases that fit a clear standard of care. You can think of this as the by-the-book treatment plan. If a patient's situation perfectly matches the established national guidelines, it's considered a standard of care case. And those cases, well, they might not need a full-on debate by the entire team.
And the way it works is actually pretty elegant. First, the AI pulls all the important data for a patient, biopsy results, scans, you name it. Then it cross-references all that information against this huge database of clinical guidelines. And based on that comparison, it recommends a treatment plan for those more straightforward cases.
But of course, the billion-dollar question is, does it actually work in the real world? So to find out, researchers at some major UK hospitals put this whole system through a really tough two-phase trial.
The researchers were actually pretty clever about this. They used this two-pronged attack. First, they looked backwards, in what's called the retrospective phase. They fed the AI 287 old cases to see how its decisions held up. Then, they moved into a live clinical setting, testing it on 416 real-time cases. This way, the results aren't just a fluke, they're solid.
So how do you even measure success here? The key metric was something called concordance. It sounds fancy, but it's basically just the rate of agreement. They wanted to see how often the AI's recommendation matched the decision made by a panel of top doctors, who were basically the gold standard.
Okay, let's get into the results, because this is where the story gets really, really interesting.
So, in that first phase, the researchers put the AI head-to-head against the original decisions that were made by those MD meetings from years ago. Both of them were judged against that ground truth that was set by the expert panel. And the difference was, wow, just staggering. The Prostate DS AI agreed with the expert panel's gold standard decision 92% of the time. The original, time-pressed MDT meetings, they only agreed with that same gold standard 53% of the time. This tells you the AI isn't just faster, it might actually be more consistent at applying the latest best practices. So what does this actually mean day to day? Well, the study figured that the AI could safely identify and streamline over a third, 33.8%, of all prostate cancer cases. Just think about that. That's 1 out of every 3 cases that could be handled more efficiently without cutting any corners on care. And when we say streamlining, all it means is that these patients, the ones whose cases are pretty straightforward, wouldn't need to take up time in that long, expensive meeting. Their file, along with the AI's recommendation, could go straight to the treating doctor. That frees up so much time for the truly complex cases.
And here it is, the ultimate safety check. For that group of streamlined cases, the ones put in the fast lane, was the AI right? The answer is a huge yes. Its recommendations match the final decisions made by the human team an incredible 96.3% of the time. I mean, that is powerful proof that this AI is exceptionally reliable.
So, what does this all mean for the future of medicine? This isn't just about being more efficient. It's about building a whole new, much smarter reality for cancer care.
You know, the benefits just ripple outwards. The team gets more time for their most complex patients. The hospital saves money. Decisions are more consistently aligned with the very latest guidelines. And the AI can even act as a learning tool for younger doctors and help spot patients who could get into cutting-edge clinical trials. It's a win all around.
I think this is the most important thing to take away. The AI is not the new boss in the room. It's a new member of the team, a really, really well-read and consistent member. During the trial, its recommendation was just right there on the screen, serving as another expert voice to help the human team do what they do best.
So this leaves us with a final, really big thought. This study strongly suggests we're heading into an era where the best patient care isn't going to come from just humans or just AI. It's going to come from a seamless, powerful partnership between the two. And that's a pretty exciting future to think about. Thanks for joining us on The Explainer.